I'm Dr. Sivakumar, practicing as a clinical as well as senior interventional cardiologist in a place called Madurai in Tamil Nadu, in a hospital called Madurai Meenakshi Mission Hospital for the past 25 years. I have a good, rich experience in doing angiograms and angioplasties, as well as basic healthcare providing to cardiac patients in diabetes, hypertension, and coronary heart disease. Of course, it is proven not only from Wuhan as well as from various global perspective. It invokes a lot of inflammatory injuries to the heart. Particularly, it causes myocarditis. It downregulates ACE2 receptors. It causes hypercoagulability. It increases catecholamines so that it can cause stress cardiomyopathy. It can cause cytokine storm, by which it can cause reduction in BP. It can cause ARDS. It can push someone into a heart failure situation. It can really make someone very lethal. This is fantastic. There are various ways to keep your heart healthy, like doing regular exercise, even though you are in lockdown. Keep your hypertension under checked. Keep your diabetes, HbA1c, fasting, and postprandial sugars under checked. Keep your all CAD medications on proper. Make sure you are on strict adherence to various heart failure medications, and like any other general population doing like preventive measures like social distancing, hand wash, wearing masks, avoiding exposing yourself to a known COVID patient, all that goes well. That's a very intriguing question. I think there are various happy hormones. One can indulge in those activities like indulge in exercise, keep your endorphins on the higher side to be happy, and enrich more time on helping others by carrying them and sharing them so that your serotonin goes up, which again makes you happy. And be grateful to what you had so far in life, and self-appreciate yourself so that your dopamine goes up, makes you happy again, mental happiness it gives. And get connected to your friends and relatives on Skype or video so that your oxytocin level goes up. These are all the ways one can keep your mental status boomed up. When your mental status is boomed up, your immune status is boomed up, and your way in handling the coronavirus will be perfect.
Anything?
And you can quit smoking, you can quit alcohol, you can have a low fat and low carb diet, you can keep a high protein diet, you can also indulge in meditation and yoga practices. This is very important because there are a lot of conflicts and controversies as this virus involves with ACE2 downregulation. So the very clear point I want to mention here, this is from the ESC guideline release, that if somebody is on AC inhibitor like Ramipril from IPCA, they should be continue to take it. There is no need to stop the medication, and make sure your blood pressure is always less than 130/90 all the time. If there are, for various reasons, being in lockdown, you are anxious, if your heart rate and blood pressure is going up, considering add in addition to Ramcar, you can also consider adding Rivolol XL. I think that's the key here. If you're an alternate AC inhibitor like Ramipril, Ramcar, you keep continuing it. This is absolutely, this is what happened in West. In spite of such a developed countries like Italy, France, Germany, US, why there was such a morbidity? It is because of the elderly. It is because of the elderly population living with various comorbidities like post-MI, symptomatic or asymptomatic LV dysfunction, coexisting hypertension, coexisting diabetes, dilated cardiomyopathies, heart failure with reduced ejection fraction, all predisposed them. It was a triggering coronavirus and COVID-19. on the backdrop of a comorbid individual, which pushed them a lethal case, which they finally succumbed. I don't think there have to be a change in cardiac medications if they are already pre-existing on. I would rather say if they are on antihypertensive medications, they should continue to take the antihypertensive medications. If they are on antiplatelets for cardiac disease, they should continue to take it. Similarly, when they are on antidiabetics, they should continue to take the antidiabetics. If they are on moderate intensity or high intensity cholesterol lowering drug like statin, they should continue to take those drugs. Yeah, this is a wonderful question. Any hypertensive patients or any heart failure patients with reduced ejection fraction or preserved ejection fraction, they should adhere to a diet which lessens salt. They should continue the heart failure medications which they were on already on. They should continue to take it. And the most key here is, if they remain stable, they should avoid unnecessary visits to the clinics or hospitals. Similarly, when they come across any kind of an untoward symptoms, urgent cardiac symptoms, in fear of or in anxiety of getting corona by visiting a hospital, they should not postpone their visit to a emergency care. Yeah, I see. Unlike West, where these comorbidities were 1 or 2 decades ahead of us, whereas in our part of population, the so-called comorbidities like CAD, hypertension, diabetes, heart failure sets in almost 10 to 15 years earlier. So we quite commonly see late 50s to early 70s healthy people with comorbidities. They will be socioeconomically active to the family. They'll be still making financial earnings to the family. So instead of restricting them homebound, I think with all the precautions which the government has already instituted upon, like social distancing, mask, I think we should motivate them with the awareness. They should be able to go out. They should be able to visit their offices with proper distancing, mask, hand washing, and they should think every patient, because we are into the 4th phase of lockdown, every patient you should take it as a possible corona patient and be aware and be precautious and keep moving. In a country like us where the economy is also under stake, we cannot keep on continuing with the model of lockdown. I think we need to balance between um, uh, slowing down of and slow exit from lockdown, continue to practice these precautions, and keep viable and economically viable to the family as well as to the country. Yeah, this is absolutely a very needy question here, because diet can definitely influence this disease, not in terms of diets or nutritional replacements which are going to prevent getting infection, prevent you from coronavirus. It is basically these diets in terms of multivitamins or micronutrients act as immune modulators, make your immune system, make your WBC able enough to handle the virus. I can tell you, like vitamin C in the dose of anywhere between 200 to 500 mg per day should be easily available. Zinc as a tablet, vitamin D, any vitamin D preparation should have an available dose of 2000 internal units per day. Vitamin E and a lot of fruits and vegetables, as you said. I think this should handle your immune system to handle the contagion well. This is certainly very important in this present context. And if you look at the last 1 week or so, our per day cases are really going up. And we were practicing strict lockdown when cases were on the lesser side. Now, for various reasons, there is release of lockdown. But the government can only tell you about this virus, about this disease, and about all precautionary measures. I think everyone should take it as this is not a lockdown in terms of protecting the country against neighboring country in war front. This is protecting every individual in terms of health, not to infect others. Until otherwise, everyone is safe. Not everybody is safe here. Let's not get infected. Let's not infect others also. When you are getting tested for this coronavirus, within 3 days of your symptoms, anywhere within 5 days of symptoms, you are likely to come your test as negative. That doesn't mean you are true negative. It could be false negative. So you should take every patient you come across as a potential COVID patient. And there are well proven data for asymptomatic carriers, healthy carriers moving around, which can potentially infect the elderly comorbid patients sitting at the home. So the one who roams around healthy youngsters should make sure when they come back home, they practice social distance among their elderly subset of patients, particularly when they have fourth phase of this lockdown and we have touched more than 1 lakh cases now. I think we need to continue, and this is the very crucial phase, particularly for our particularly for our country, that we should continue to practice all the preventive measures.